Okay, so we're in ultrasound now. We're going to look at a couple of pictures that we took. And so the first question would be, so why do we need to perform an ultrasound if we've already taken x-rays? Well, an x-ray is great because it gives us size and shadows, and it was able to help us identify a mass in this patient. But now we want to look inside the organ, inside the mass, and try to pinpoint the exact organ that this mass is associated with. And again, furthermore, to see if there's multiple tumors or if there's bleeding. And here, there's a picture that shows this grainy homogeneous structure, which is actually the spleen, and it's the normal part of the spleen. But now we have this big thing that projects away from the spleen, and we only have part of it captured in this image, and this is all tumor. Another name would just be a mass, because we don't know if it's benign or malignant. We just know that it doesn't belong there and it's large. And so we also look at some other structures, and this is just an example of the urinary bladder. It was very small. It's not able to fill normally because it's being compressed by this tumor. And so the animal's having to urinate off, and that's another complaint that the owner had noticed. And then we look at other structures like the kidneys, and here's an example of the left kidney, which looks normal. The right kidney in this view is being compressed by the tumor, which is everything above this arrow. Everything between here and here is tumor. The actual kidney itself, even though it looks a little fuzzy in this image, is normal. And so we think this is what we would call a single or solitary mass. It's just very large. This patient is anemic, but it's not apparently from any kind of bleed. And so if tumors have been in a belly for a long time, they cause a condition called anemia of chronic disease. And so the body's just not making red blood cells enough. And furthermore, the spleen is involved with red blood cell filtering, and if it's not functioning properly, it can't do that. And so a couple of reasons why this patient's anemic. So we've got a lot of confidence now that surgery is indicated, and so the next step is surgery today.